had a patient who lives in the Midwest alone. His dad was really sick with COVID. He relayed all the information that the doctors had told him, and his dad was quickly deteriorating. And then I just asked him, "Are you okay? This is a lot to take on, and you haven't seen your dad. You're trying to make these choices." And then he started crying. And he said, "No one's really asked me that, and I haven't really had a chance to think about what's going on." And he said to me, "I can't believe this doctor from across the country is taking the time to speak with me, and I'm just so grateful."
So I think with Summus, we're really trying to bring back the human touch in medicine and bring back humanity. We've lost it in medicine a lot. It's a lot of speed, numbers of patients, and doctors don't really get the time to just connect with people.
People go into medicine for lots of reasons, but most of the disciplines treasure that human connection.
The challenge in healthcare today is just, the average doctor's appointment is like 14 minutes. What we do is change that. We just ask a simple question in a box. How can we help you with your medical question? Could be, I've got a migraine, could be, I just got diagnosed with cancer. We will match them to one of our Summus MDs, top of their game. They're gonna help them understand what that health question is, really to help and guide care in a powerful way.
With Summus, we have time to educate and time to really teach people what the medical problems are, whether it's the diagnosis, whether it's what the test means, everything in between. We have time to educate people and teach them, because I think a lot of the anxiety stems around things that people just don't know.
We are building a true marketplace for expertise that is allowing us to do a lot of cool things in healthcare. For physicians, it's really efficient. So the concept of our business model plus a virtual medium allows you to really see doctors across the country. You could be located in Connecticut, the doctor could be located in California, your mother could be located in Texas, and everybody can participate in this conversation. So you get this very rich dialogue where, geographic boundaries don't matter.
Patients who go to high-volume centers of excellence will live longer, and they'll live with a better quality of life. Summus technology allows someone to have access to that high level of care they might not get.
Within our network, we've got over 4,000 physicians, growing by the day.
An incredibly important part of the Summus story is the network of specialists that have been built out.
That network has effectively been curated and can be deployed in very personalized, condition-specific ways for our members.
If you have all these different doctors that have that same goal working together, you're only going to get a better result.
We believe that the care we give is unparalleled to anyone else in the field. We can help more people in more ways at a greater distance than ever before.
It's not a very well understood dynamic, just how much of a spectrum of quality there is across medicine. So learning more about the relationships that had been built across 17 of the top 20 hospitals in the United States, making an investment in this space was completely intuitive to me because I had lived it for multiple years, and frankly, I continue to live it.
But the most important thing is that human connection between our organization and the customers that we serve and the physicians that are connecting with them. What's exciting about our business is not just the mission. On a daily basis, we're helping people make good decisions in healthcare. We're helping them understand what they have to deal with. So it's an exciting time for us.